Well, good day and welcome once again to Moments with Dr. Steve. I'm Dr. Steve Bonenberger, and that's Dr. Buddy Wagner. In a minute, we're going to have him continue his conversation. And really, it's been a series of lessons he's been teaching us on the idea of interventive, uh, hypnotic, therapeutic approach that he is a master of. He's a subject matter expert at this matter, and it's been a lot of fun, and many of you have watched and many of you have engaged with the conversation. We have defined hypnosis, we've defined how it works, we've explained to you how Dr. Wagner uses hypnosis in his therapeutic practice and the things that he does with human beings that are ailing and hurting. And we have established the fact that Dr. Wagner came to this because he was indeed frustrated with the more long form of therapeutic encounters with then students and other patients that were not getting the kind of outcomes that he wanted, and that drove him to think about finding better and more reliable, if you will, solutions. And so, Dr. Wagner, we welcome you, sir, back to our program, and glad to see you on this day.
Thank you. So it's good to be back, and I look
Well,
forward to
in this day, Doc, we are going to talk specifically into what you call the guts, the meat, the exactly how the therapeutic encounter is then worked within the process of therapeutic hypnosis, and that's the interventive model that you use, sir. So let's begin at the biggest level, if you could. Just define hypnosis and give us again your understanding, so because some people may not have seen our other segments, of the fact that no one can go into this without consent, knowledge, and in fact they have to be the person that guides themselves. So if you just start at those big levels, then we'll dive in just a few minutes then down into the whole ideas of trance phenomena and how it in fact then impacts the human spirit, sir.
Okay. Hypnosis is an altered state of consciousness. It's not unconsciousness, but an altered state of consciousness. When an individual is in trance, they are conscious, they are aware of what's going on, and they're in control of what's going on. Hypnotists cannot make anyone do or say anything that they don't want to say or do. So the person who is in trance is in control. The value of therapeutic hypnosis is that it works with the unconscious mind rather than the conscious mind. The conscious mind is very narrow, very rigid in its thinking. It doesn't like change. The unconscious, on the other hand, is very creative. It's very open to new ideas and new possibilities. And so most problems that people have are unconscious problems. People don't consciously choose to be anxious or to have phobias or panic attacks or chronic pain. Those are all unconscious processes. And so it makes sense to me that the most effective way to treat them is through the unconscious. And that's what hypnosis does. All hypnosis is self-hypnosis. I cannot hypnotize anyone other than myself. If someone does what I ask them to do, they will go into trance, but it won't be me putting them into trance. It'll be them putting themselves into trance. And as I said before, they're in total control. I'm simply making suggestions that their unconscious can use to solve whatever their problem might be. So that's kind of an overview.
And we appreciate that, sir. And so in the next few minutes, we're going to talk about what you call trance phenomena. Let's just start with that's a big term, Doc. And those are big words that most people are not going to be familiar with, especially when you kind of link them and wed them together. So first off, what is a trance? And then what is a phenomena, and how, when you link those two together, is the potential for healing brought to the surface?
Well, as I've already said, trance is an altered state of consciousness. The phenomena are the treatment methods of helping a person resolve their problem. And the interesting thing to me about these phenomena are that some of them are things that the mental health profession goes crazy about. when you start talking about disassociation, they say, oh no, mentally ill. No, perfectly legitimate way to solve a problem is through disassociation, which we'll talk about. So the phenomena are simply the ways of treating whatever the issue might be. And we'll go through. I have 10 of them. We'll go through 5 of them tonight, and then 5 in our next session.
That is so awesome, and he is absolutely right. We have already talked about disassociation in one of our previous segments and sessions, and we're going to do that in a more detailed and diving a little deeper in this day. And he is 100% right. I use disassociation every single day, Doc. There is not a single encounter I have with a patient or client, or whatever they choose to call themselves, or I choose to call them, on that day, that I do not use disassociation work. I believe in distancing, and I believe it strongly. So I want you to explain what disassociation means, how it works, and then point of fact in this discussion. How does it work when you use it for the benefit of bringing healing to that client during and through the practice of interventive hypnotic therapeutic encounters?
Yeah, disassociation is a way of helping a person remove himself or herself from the problem. And so they're looking at the problem from a distance rather than it being inside of them. They move it outside of them and look at it objectively, so to speak. And so, let's suppose I'm working with a person with a phobia. I might use the metaphor of a movie theater. And I might say, you might want to see yourself in a movie theater sitting on the 8th or 10th row, and you're watching a movie, but you realize this is a movie of yourself. But as you sit there in your seat feeling calm and comfortable and relaxed, you realize that the person on the screen is the person who has the phobia. And so you can begin to pay attention to the differences between yourself as you sit there in your seat feeling calm and comfortable and relaxed, and the person on the theme who's on the screen who suffers from the phobia. You can notice how you look different than that person looks. You can notice how you act different than that person acts. You can notice how you think different than that person thinks. And you can notice how you feel different than that person feels. So what I'm trying to help them do is disassociate from the phobia so that they're looking at it from a distance and seeing it from a distance and realizing the differences between themselves as they sit there in their seat of comfort and that person on the screen who suffers from the phobia. And so it's simply a way of helping them look at the problem objectively rather than subjectively.
I use this every single day, folks. If you or somebody that's in your family comes to see me, they are going to experience dissociation, because of all the techniques I've learned over the years, Doc, in my little tool belt, this is the one I find to be one of the most helpful tools ever. And I love that. And thank you for explaining that to us with such clarity and such distinction, sir. Now let's talk about age regression. How does the therapeutic encounter, as a person is engaged in the hypnotic process, how does that happen, and how does that help them as you work them through age regression techniques?
Yeah, age regression, a couple of ways that it can be used. One is if there's been trauma in a person's life at an earlier point in time, by regressing them back to that point, they can take with them resources. For example, let's suppose that a person was sexually abused as a early young teenager, and they felt powerless. There was no one there to protect them or to help them, and so through age regression, they can go back to that experience, but they can take someone with them. They can take a parent with them, or they can take a friend with them, or someone who will protect them with them and go back to that experience. But now they have a protector there to protect them from that abuse that's occurring. And so that's one way age regression can be used. But another way is it can be used to recover something from a person's life earlier that they need now. So, for example, let's suppose that phobia. Let's suppose that they have a phobia of elevators, we'll say. But there was a time in their life when they could ride elevators without any problem.
Sure.
So to regress them back to that time and let them experience again riding that elevator, enjoying it, having fun with it, and they can go back and experience that, and then bring it up through the years to the present, so that they have it now in the present tense, rather than it just being a past tense thing. So age regression is a very powerful phenomena that we can use in helping a person overcome whatever the issue might be.
Just yesterday, Doc, I was with a patient and I did exactly what you're talking about. Literally did this process. And so, once again, these are very, very powerful tools. If you're stuck, if you're somebody in your family is stuck and you can't find a way out, I'm suggesting to you that the techniques, the ideas underneath, I always preface things or, put them in the strong parentheses, Doc, of with the understanding that you have a competent and caring and a safe guide. There's the key for me always. So we talked about dissociation, use it often, age regression. Just yesterday, I was using this specific technique that is in also my toolbox. I'm not as proficient as you for sure. Now let's talk about amnesia. What do you mean about that, kind sir?
And amnesia is another one of these phenomena that the mental health profession gets all upset about. Oh no, they can't remember, they have amnesia. That's horrible. Well, it's not horrible if you have chronic pain and you forget about it.
There you go.
You have amnesia, pretty useful phenomena. And so amnesia is simply the experience of forgetting something that exists. And we experience amnesia frequently in our lives. I meet somebody and I haven't seen them in a while, and I can't remember their name.
Sure.
I have amnesia, or I go to the grocery store to get 3 items and I can only remember 2 of the items I went to get. I have amnesia. And so amnesia is a natural, normal phenomena that we experience regularly in our lives. So why not put it to use? Why not use it in a productive way? And so again, chronic pain is a good example. So I might suggest to a person that he can remember to forget his pain, or he can forget to remember it. Doesn't matter. Either way is okay. And I might, tell a story about forgetting something, where I put something. Or I might use a story of a client. And this was a true story. I had a client once who came to me who had misplaced $30,000. They had sold a boat for $30,000, and as soon as or shortly after they sold it, before they had time to go to the bank, they went on a trip, and so they took the money and they thought they put it in their freezer. When they got back home, they went to the freezer and the money wasn't there, and so they couldn't remember where they had put it. They had amnesia. For where they had placed the money, and so they came to me to see if I could help them recover the money. So amnesia occurs frequently to us, but most of the time we don't think about using it in a productive way. And so through hypnosis, I can suggest to a person that they forget pain or a phobia or whatever the issue might be.
So far we've talked about trance phenomena, we've talked about dissociation, we've talked about age regression, we've talked about amnesia. Now, Doc, you talk a little bit about this thing you call time distortion. I think I know what you mean. I know what I do when I think I distort time for clients, but I'm interested in what you do, my good friend.
Okay. Well, time distortion is where we either speed time up or we slow it down. And, when I'm in pain, I want to speed time up.
Okay.
When I'm feeling good, I want to slow it down. And so, to suggest to someone, to remind someone, because we've all, again, this is a natural, normal phenomena that we all experience. You know, if I'm listening to I'm in church and I'm listening to a sermon and it's boring as heck, you know, then what happens? I slow time down and it seems like it lasts forever. When really the thing I ought to do in that situation is speed time up and make it go faster so that the sermon gets over quicker. So it's simply helping a person recognize that when they're in pain, they can speed time up, and when they're feeling good, they can slow it down. And so, you know, I might make that suggestion through any of the ways that I talked about in our last session. I can do it by thinking out loud. I can say, you know, I wonder what would happen if, when you're in intense pain, I wonder what would happen if you were to speed time up and make it go faster. Or I might tell a story about another client who speeded time up or slowed it down, whichever, you know, or I might use a metaphor to do that. But just making the suggestion that it's possible to distort time because we do it naturally anyway. All of us know what it feels like to slow time down or to speed time up. So we know how to do it. It's just a matter of doing it when we need to do it.
And you
And
know,
doing,
Doc, where I tend to use this in my own life is when I'm still a tennis player at this advanced age. But all throughout the course of my life, I have used the ability, and I've gotten pretty good at being able to slow time down when a point's happening. So far, we've talked about disassociation, we've talked about age regression, amnesia, and time distortion. And to close out this session, Doc, we're going to talk about what you call positive hallucination. Can you explain that to us, please? I'm curious what that is.
yeah, positive hallucination is where I see something that's not there, or I hear something that's not there, or I feel something that's not there. And again, we've all experienced this. Uh, I've been in a crowd of people and I hear somebody call my name, but I turn around and look and there's nobody there calling my name, but
Sure.
I heard my name being called. Or, you know, we've all experienced seeing things that weren't really there. Driving down the highway, you know, on a hot, humid day, you can see what looks like water up ahead, but it's not. You know, you've hallucinated that water. And so we all make things appear that aren't really there, or hear things that aren't really there, or feel things that aren't really there. For example, if I started talking about uh, what would it feel like if you stepped on an ant bed and all of those ants started crawling up your legs and biting you? Before you know it, you're actually feeling those ants biting your legs, even though there are no ants there. And so positive hallucination is simply seeing or hearing or feeling something that's not really there. Uh, I use this a lot with people who have phobias of animals. You know, like well, one young lady I worked with had a phobia of frogs. And so what I did in the trance, I suggested to her to look down on the floor and see the frog that's sitting down on the floor. And she actually saw that frog. I asked her to describe it. She described it for me. And then I told her, okay, I'm going to bend down and pick the frog up and hold it in my hand. And when you're ready, you can take the frog out of my hand and hold it in your hand. And she literally did that. And so she hallucinated that frog, and by holding it in her hand, she overcame her phobia. And so positive hallucination, again, is simply seeing or hearing or feeling something that doesn't really exist, but we see it or hear it or feel it as if it exists.
Doc, is it fair to say that the whole person or the person that is approaching wholeness learns then to be able to blend both the conscious and the unconscious and can use these techniques, I wouldn't say at will, but at need, and can muster them once they understand and grasp? In other words, is it fair to say that one of the benefits of the work that you do, sir, with hypnotic encounters is that the patient, the client, the recipient at some point can utilize these things on their own when there is need that is presented? Is that fair, or am I stretching?
Yeah, that's fair. Now, it's probably not quite as easy as you've made it sound, uh, but certainly, I mean, that's what I want. I want my clients to, I want every client to learn how to go into trance without me being there directing them, and I want them to know how to use these phenomena so that they don't need me anymore. And that's again one of the beauties of hypnosis is that in one session or no more than 4 sessions, they should be able to uh, handle their chronic pain or the phobia or the panic attacks, whatever the issue is. They should be able to uh, handle that without me being there at all. Matter of fact, one of the things I suggest to clients many times, particularly those who lack confidence in their own ability, I suggest to them that they can hear my voice anytime they want to hear it. They can hallucinate my voice,
Exactly.
and I quote, I'm there with them because they can hear my voice. And so, yeah, certainly that's the goal is for them to learn how to use these phenomena on their own when they need them.
The reason I said that is because with the clients I see and the practice I do and have done for 40 years now, and much thanks to you for goading me, I suppose, in a positive way, or probing me or poking me. This man spoke positive things into my life many, many years ago, and that's the reason that I'm a healer on this day. Is I encourage my clients to find the skill internally to use these things that I work to teach them and to work with them on their own. And I love your idea of implanting your voice as this kind of constant guide. I'm a person that believes that competent guides are important. Well, it's been a joy to have you again. He'll be back again soon, we hope. And that is Dr. Buddy Wagner, and he's an expert and certainly a subject matter expert and a practitioner in the field of hypnotic therapeutic encounters. And of course, you know who I am. I'm Dr. Steve Bonenberger, and I've been doing this a long, long time. And I'm grateful that you allow us into your life and that we keep bringing wonderful people with wonderful ideas, and all of our work has the postscript, if you will, of we believe in humans and we believe human improvement is indeed possible. Till next time, that's Dr. Buddy Wagner. I'm Dr. Steve Bonenberger. Travel far.